everyone, I'm Sister Leska, and I briefly want to tell you today why I chose to study veterinary nursing and why it is a fantastic thing to do. Dr. van Reineveld will be in after me, but she's the one that is going to tell you about the requirements and more about the course itself. But I want to give you a bit of personal experience, just that maybe you hear something that I say today, you see it in yourselves, and you realize that nursing can be an option for you. I know that most of you are here today, not for nursing, but because you want to be the future animal doctors of the world. How many of you actually knew something about nursing or do know something about the course as you sit here? Okay, about the same response I had in the other room, so very few. Okay, a lot of you, I think, are under the impression that veterinary science is the only thing to do if you want to work with animals. Nursing is definitely an option, and at the end of the day, it can be an informed choice. After my investigations, when I wanted to study again, which, I finished school a long time ago, and I worked for years, but doing what I loved, and working 24 hours a day, 7 days a week, and having to live at home with my parents most of the time, because I was earning 2,000 to 3,000 Rand a month. I mean, I think most of you can understand that that means really, really nothing. You cannot put in petrol to get you from point A to B these days. So I decided to study again, and I investigated the veterinary nursing degree, animal health technician, which is more sort of, working out in labs, going to do inspections at abattoirs, that type of thing, and also then investigated nursing. I knew that nursing ticked every single box for me. It may be a diploma course spanning 2 years. And one thing you must understand is that the level of education that you get in comparison to the veterinary degree is definitely not of a lower standard. It may be a shorter course, it may be a smaller workload, but the intensity of the work, the information that you get, the dedication and motivation that you need to get yourself through 2 years is definitely also not less than getting through a veterinary degree. I chose nursing because I'm very much a hands-on person. I love nurturing animals. I love giving TLC and getting them through the night. I love going the extra mile for my patients and for my clients. Another thing, as a vet and as a nurse, you're going to have a lot of client contact. Don't think that you're just going to go and work with animals and the cute and fluffies of the world. You have to deal with the clients too. I believe that you can get theoretical book knowledge through reading and researching by yourself. You, as a veterinary nurse, can get the knowledge that a vet has from a book through keen interest and through obviously personal practical experience. I definitely did not wish to diagnose patients. As much as I love working with my patients, I don't want to see something on the table, hear an explanation, and try to figure out what's wrong with it. I also hate the idea of doing surgery. That was not for me. Standing in a theater for 8 or 9 hours, looking at a bone, trying to piece it together, just has absolutely no thrill for me. There are people that thrive on it, but as I say, just not for me. I also do not want to be the one that is always responsible for legal matters. This is also something that is very important. As a vet, you're responsible for such things, and everything comes back to you as the vet. I'm not saying any of this to put off our future vets. I'm merely trying to explain why nursing was the only option for me. And it was not something that I fell back on because I could not get into veterinary science. The marks that you need to get into nursing or the requirements are slightly lower than for the veterinary degree, but I don't think that anybody should use it as just a second choice. As a vet and a nurse, it requires completely different types of people. So I feel if you're going to go for nursing, make sure that's what you want to do, the same as going for vet, and don't have a second choice. Go for it with all you've got. Subjects like microbiology, physiology, anatomy, medical and surgical nursing, pharmacology, that is all done in your veterinary nursing diploma. Throughout the 2 years that you are at Onderstepoort, you will definitely be involved in the day-to-day running of the hospital. As nurses, in our first year, we already go into the hospital for mornings just to see how things work. And then when the second years start writing the exams, the first years take over entirely. They have holiday clinics where they are there from morning till evening, also working some night shifts. And then again, in the beginning of the year, they start their classes, and probably around about April, May, you go into the hospital full-time, joining the vet students. When you leave Onderstepoort as a qualified sister, you can be 100% sure that your skills will be refined and you will be able to cope with anything thrown at you out in the big wide world. Opportunities to work at big institutions like Onderstepoort may present themselves to you. I was fortunate enough to get a locum position at the reproduction department a month after I finished studying. And a year and a bit later, I'm still here, and I will now work half day at production and half day at reproduction. And I do love every minute of it. Onderstepoort is unique in the sense that we work with students, and you cannot turn your back for a minute. It's a big responsibility teaching and training people, especially when our new vet students come into the hospital and they have no idea which end of the needle is which and which end of the animal is which. You have to watch them all the time. Okay. It can be very frustrating, and there are days that I want to run away, and you just have to go around the corner and take a breather. But when a student or a nurse comes to you at the end of the year and says thank you for something, a small thing that you've said or done that's actually made an impact on their lives, it is very rewarding. Other work opportunities for nurses obviously include working in private practice. Private practice gets divided up into small animals, which is your dogs and cats, and then large animals, which is what I do, which is at, well, we call it production, but basically your farm animals. So you cover all things like cattle, goats, sheep, pigs, you name it. Also, you can work with equines, which I'm sure most of you know as horses, and then birds, exotics, and wildlife. You can also, once you're qualified, work anywhere in South Africa. If there's a veterinary practice, you as a nurse can go and work there. And your qualification may require a bridging course or an entrance exam, but you're also able, with what you've got, to go and work anywhere overseas that you choose. Then there's community and charity work. We have animal welfares all over. We have SPCAs, and a lot of the students and nurses get involved in CVCs, which is something I also do on a more or less constant basis. That stands for community vet clinics. We go out into the poorer areas, and you do basic veterinary care, which is vaccinations, deworming. You do a quick clinical, you give advice. So once a month out here, Pretoria North, which is actually happening tomorrow, we go out and we do that. And it's also a very rewarding thing to be able to help somebody. You don't charge them the earth, and you just help people that actually really love their animals, basically out the goodness of your heart. Then rehabilitation, in the sense of getting animals back into the wild, or also doing physical rehab, which is what a physiotherapist would do with us humans. That is also becoming a great field of expertise for bless you, a great field of expertise for sisters especially. Then one thing you also need to realize is that as a nurse or a sister, you will 99% of the time be working hand in hand with a vet. Nurses are limited to what they can do legally on their own or without supervision. If your goal at the end of the day is to do something like surgery, then you can basically ignore what I've had to say, because then nursing is not for you. If your goal is to nurture animals and be the person who sits up all night ensuring that TLC is given, and to possibly be the glue that holds the practice together at the end of the day, you can consider nursing. And I could go on forever and tell you why I am passionate about nursing and why it is a great thing to do, but I'm going to leave things where they are now. And if you guys have questions afterwards, you're welcome to come and ask me. I do have to get back to my clinic, but I will take a few questions. And hopefully we will see some of your faces here in the coming years. Okay.